Eastern Idaho Regional Medical Center is seeing a convergence of two issues colliding simultaneously that are impacting their ICU and their ER volume. Local News 8 reporter Chelsea Breyer tells us more.
Summertime usually brings an increased rate of trauma-related visits to Eastern Idaho Regional Medical Center. These injuries usually occur to outside residents who come to the area for recreational purposes. ERMAC Director of Marketing and Communications, Colleen Neiman, says there are not as many out-of-town visitors coming to the area. She says locals are recreating and sometimes injuring themselves severely.
We're seeing lots of accidents involving ATVs and boating, a lot more vehicle accidents, and a lot more burns.
She says ERMAC saw 17 burn-related injuries over the 4th of July weekend, which is well above average for the hospital.
We wonder if because there weren't fireworks displays for people to go watch, more people were doing fireworks at home and thus at a greater risk of injuring themselves.
Another rise in hospitalizations is related to COVID-19.
We are starting to see stronger numbers both in the outpatient setting and in our facility.
Colleen says because ICU bed space is being used for the increased number of trauma-related injuries, ERMAC has prepared surge plans for COVID-19 patients. Colleen says going forward, healthcare workers are hoping people will follow precautions to reduce the spread of COVID and be safe and aware when recreating to keep the ICU capacity volume lower in case of a surge situation.
Our number one concern going forward is that both a high trauma season with growing numbers of COVID in our community could come together at the same time and result in significant number of hospitalizations.
He says that people seem to have the attitude that they will mask when the COVID situation reaches a certain level. She wants the community to understand that the hospital is very full because of non-COVID related injuries. This situation is straining the healthcare system and causing concern if the community reaches a higher need for COVID hospitalizations. She urges the public to start masking now to prevent further spread of COVID in our community. Reporting in Idaho Falls, I'm Chelsea Breyer.